morning, everybody. It's a pleasure being here. So we got lots to cover today. We're going to do a whole day on drugs. I had a cab take me from the train station yesterday over to the hotel, and there was a woman sitting in the front seat with him. And so he said to me, "So what are you here for?" I said, "I'm doing a seminar, tomorrow." And he said, "Oh, for who?" And I said, "Well, I'm just doing a seminar." And he said, "Oh, what's it on?" I said, "Drugs." He went, "Whoa!" And so the woman sitting in front was here for a seminar. I don't know where she came from, but she was sitting in the front seat. And she was here for a seminar in the same hotel on HIV and AIDS and all that, so it was really rather humorous. So he jumped back about 3 feet when I said drugs. Anyway, so I got an email from a friend this morning, and she said, this is funny, she said, "New study on preventing dementia, work longer." God, how long do we have to work? Anyway, so in case you're interested, you young girls in here, you're going to have to work till you're 90. So anyway, we're going to do drugs. And I've picked out some of the more common drugs, of course, but I'm here to answer any questions. If you have other questions for other drugs that I might not have brought up, there's certainly enough out there. So we're going to start with some numbers here. 30 years ago, there were approximately 900 drugs to choose from. Now there are 12,000. So for those of you that are not retiring anytime soon, those numbers will just keep increasing. Every day, I'm on drug alerts from FDA and all these other places. Every day I get hits on new drugs that are out. The good news is they're mostly in the same categories or classes, so it's just another drug in the same class, but it still adds to the list of us having to learn these things. All right, plus we've got, of course, over 600 herbal products that people take, interacting with prescribed drugs, including your cardiac drugs, interacting with antidepressants, interacting with all drugs, actually, not just the cardiacs and antidepressants. So we got to be very aware of what your patients are taking, and they don't sometimes tell us, and we've got to specifically say, are you taking stuff that you've read about in Prevention Magazine? Are you taking stuff that your best friend is taking? Have you borrowed her drugs? So all of those things are very important. St. John's wort still remains the #1 herbal product that is taken around the United States and the world, actually. This is an antidepressant, as you know. Does it work? It's an interesting question. The answer is yes. It does work. It does have some properties that improve your mood, also reduce cortisol levels, which we are now thinking also contribute to depression because high stress, low serotonin. You lower cortisol because of the high stress, lower that, and you actually may get a rise in your serotonin. So it's very fascinating, the possibility of how St. John's wort does help to improve mood. Now, it's not the be-all and end-all. You would never prescribe it for somebody who is suicidal. Hello? That would not be a smart move. Well, how about a little St. John's wort? That's not going to work. That'll make you feel better. We actually have something I'm going to digress for a moment. I think some of you in psych nursing may have heard about this study. It's a fascinating study. People who are literally ready to kill themselves. We can give them an IV infusion of a drug we use in veterinary medicine called ketamine. Intravenous infusion of ketamine, literally within minutes to an hour, they feel better. They stop their suicidal ideation. They do not want to kill themselves. It lasts for about a week. Now, that doesn't mean they're coming in for weekly ketamine infusions, you all. And it doesn't mean that this has been approved by the FDA. This is a study. It's investigational, but it is remarkable in what it does for your mood immediately. So that's fascinating. We don't go out here and recommend ketamine to anybody who is severely depressed. This is certainly an investigational therapy, but actually a very exciting one in the world of psychiatric medicine. Okay, so St. John's wort interacts with 60% of all medications. You do the math. What's 60% of 12,000? Too many to know. 7,200 in case you're interested. So St. John's wort is not a drug you want to prescribe for people who are on other drugs unless you look up those drugs and do they interact. Because St. John's wort makes the other drugs they're on less effective. So the drugs you think should be working are not working as well if they're taking St. John's wort. So those of you working with patients who like to pick things up from Walmart, Kmart, or Target, make sure you ask them about the use of St. John's wort, especially if their other drugs aren't working. So I've given you some examples, and that's just a few examples, obviously, out of 7,200 200. But cyclosporin is a drug we use, not often, but we use it in people who have had transplants, whether they're kidney, liver, lung, heart, to help prevent rejection. Okay, that's great. But if they pick up St. John's wort while they're on cyclosporin, it will make cyclosporin less effective and can actually promote rejection of their new organ. Now, how hard is it to get a heart? I mean, it's not like you got one growing in your refrigerator. Oops, this one didn't work. Let's pop a new one in. So that'll happen, you all. Before I die, we will have our own organs growing in our own refrigerators, so we can replace them on demand. That will happen. I know that. But right now it doesn't, and you can't get a heart very easily. And there's 3 cases in the literature where people have rejected heart transplants due to St. John's wort. So if you work with patients, and there are a lot of them out there today that you know as patients who are transplant patients. They're alive and well and doing beautifully, but they're also alive and well on anti-rejection drugs. Okay, now tamoxifen, very popular drug. So is breast cancer. So a popular disease called breast cancer out there, 250,000 new cases per year. Millions of women in the United States are living with breast cancer, and many of those millions are on tamoxifen. We're all familiar with it, but I'll repeat what it does. It's a fascinating drug, you all, but let me go back to its history. In the 1970s, tamoxifen was first released as a birth control pill. Interesting. More people got pregnant on it than the placebo. How rude is that? You should have been taking a sugar pill. You'd have done a lot better. I can laugh. It wasn't me, so we can laugh at the. But the interesting news is back in the 45 years ago or so, we didn't really have the pharmacology we have today, the brilliance and what we know about drugs. So this drug, tamoxifen, is called a partial agonist, partial antagonist. So okay, what does that mean, Barb? Well, in some tissues it acts as a blocker, that would be antagonist, and other tissues it acts as a booster, and that would be agonist. So in the breast, it's a beautiful blocker of growth hormones, including estrogen. So hence why we use it in people who have what are called estrogen receptor positive breast cancer. We use it to block any kind of growth hormone stimulation to a breast. It works beautifully. Okay. It also is a potent blocker in the hypothalamus, and that's why these women have hot flashes, significant hot flashes, to the point they are drenched. And when they call you and say, I hate this drug because I'm having hot flashes, then you say to them, fabulous. This is a great side effect because it tells you your drug is working better than somebody who's on tamoxifen that doesn't have hot flashes. Wow. So this is a good side effect. Maybe not for the person having it, but it is a good side effect, and we have other drugs that can help them with that. Anyway, so in your breasts and your brains, it's a what? Blocker. But in your uterus, it is a potent booster. So it actually thickens the uterine lining. It makes it grow. So here's one of the problems, obviously. It prepares the uterus for implantation. But most women who are estrogen receptor positive are really not in childbearing years. There are some that are, but they're usually women with breast cancer over the age of 50-ish. There are some younger. But here's my point. It actually prepared the uterus for implantation when you were taking it as a birth control pill, and that's why we said, whoa, 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 let's put that on the shelf for something else. In women over 50 whose ovaries are deader than a doornail, tamoxifen can actually increase the risk of uterine cancer. So very important when we have women over 50 who are on tamoxifen to keep an eye on that uterus, the thickness of the lining. The perfect candidate would be who? An over 50 woman with no uterus. Yeah, who's had a hysterectomy. She's a perfect candidate for this drug. It's too bad our uterus just can't fall out after our last child. It's a worthless piece of tissue, you all. It is. Do you need it when you're 70? No, you only need it to have kids. So if you could have that last kid, push, push, out comes a kid, push, push, out comes a placenta, and one more push, out comes the uterus. Doesn't work that way, unfortunately. It's going to fall out anyway when you're 80. When you least expect it, and you sneeze at Walmart, there it is. Sonny, would you put that in the cart? All right, so Anywho, so there's lots of folks out there who've had hysterectomies. But this is if you have a woman with a uterus and she's on tamoxifen, you must be aware there's a 2 to 7% chance she will develop uterine cancer. And it is an aggressive form of uterine cancer. So everybody needs to be aware of this slight risk, but it is a real risk. Okay, if you're on St. John's wort, however, and you're on tamoxifen, you reduce the effectiveness of this drug. You literally cut the effectiveness of the drug for breast cancer prevention. You cut it in half. 50% reduction. So please tell your breast cancer patients that are on tamoxifen, if they are depressed, we will use another antidepressant. Okay. Lots of folks out there, of course, taking drugs for HIV. There's 1.1 million Americans with AIDS in the United States, so I'm sure you have a few folks here that have it, and they're on all sorts of drugs today. But I'll tell you what's fascinating. I'm an old nurse, been around for a long, long time, and so, of course, I saw the AIDS epidemic start at its origins. Some of you young nurses didn't see it then. And in those days, when the new drugs came out, Retrovir being the first one, but then drug after drug after drug after drug, these guys, most of them were guys at the time, were taking 20, 30 pills a day and setting their alarm clock for the times they had to take them. So at 2 in the morning, they'd get up and take a pill. 6 in the morning, they'd get up and take pills. 8, 10, it was just a regimen that was unbelievably regimented. Today, most of them take 1 pill with 3 drugs in that 1 pill. So things have changed remarkably, not only about the prognosis of this disease. How many young people died back in 1982, 83, 80? They were dropping like, it was horrible, horrible, horrible. Today, we've turned it into a chronic disease because of these drugs. In the United States, not in Africa, but in the United States. So if you get AIDS today and you're 22 years old, your lifespan is approximately 47 years. So it's a chronic disease. 47 years more. So add 47 to 22. You will live to be about 70. So anyway, my point being is that we've changed the way this is treated. We still use multiple drugs, but we now have added them into 1 pill in most instances. So it's really a different era in the world of treatment of HIV. But if they're depressed and they take St. John's wort, you can reduce the effectiveness of these drugs. These drugs cost $20,000 to $30,000 a year, you all. They're not cheap. So why in the world would you reduce the effectiveness? You wouldn't or shouldn't. Okay, last but not least, let's talk about some of you young girls in here that are still on oral contraceptives. That are on oral contraceptives, not still, but on them. And you're depressed. Oh, I'm depressed. I think I'll stop and get St. John's wort. You'll think depressed. What will be the side effect? One of the causes of contraceptive failure is St. John's wort, you all. It will reduce the effectiveness of these drugs by up to 25%. This is not just a simple side effect of a cough or diarrhea. You'll be depressed for the next 70 years. I love this quote. Confucius say, "It take many nail to build crib, only 1 screw to fill it." True. So, you tell all these young girls in your clinics that are on birth control pills, do not take St. John's wort. I literally mean it. In your education, your nursing education, patient education, they're on a combined oral contraceptive, slap them a few times and say, listen to me. Do not pick up St. John's wort. If you're depressed, call me as your nurse. We will do something about it. But you will be in bigger trouble if you take St. John's wort. And if you can't understand this, then we'll put you on an IUD or something as an implant or Depo-Provera if you can't understand the consequences of this, taking this drug. So, this is one of my favorite pictures. We can put you on an IUD, which is what Princess Beatrice wore on her head to the royal wedding. So, when I saw her get out of that Bentley, I think I screamed. I laughed so hard. Why is she wearing an IUD on her head? But anyway, if you've seen the new, who works with women's health here? Anybody work in women's health primarily? Or yeah, you've seen the studies, the new studies. The contraceptive failure, if you've been on birth control pills for 4 years, it's approximately a 10% failure. So you've got a 1 in 10 chance of getting pregnant if you've been on birth control pills for 4 years. The contraceptive failure with an IUD or any other implant like a Norplant or a Depo-Provera or any of those is less than 1%. In fact, it's less than 0.1%. It's really, really, really low. So if you truly want to not have any errors, you got to go with there's lots of new IUDs out there too, you all. So anyway, so think about your patient population. Girls today, think about their IQ quotient, their intelligence quotient. No offense, I'm not saying that in a bad way. But today's pills, you all, birth control pills, you've got to make sure you take them every day. You can't say, oh, I forgot. Because with today's birth control pills, you prepare the egg. It is ready. It is sitting on the lip of the ovary. The amount of estrogen per pill today is so low that you still prepare the egg. Those of us who took birth control pills in the 70s, when they first came out in 1960, the amount of estrogen in the 60s and 70s was 80 to 100 micrograms per pill. You stopped the hypothalamic pituitary ovarian axis. You did not make eggs at all. The whole thing was just stopped dead in its tracks. These pills could stop an elephant from ovulating. You can miss a pill for a week, 2 weeks. In fact, when they told you, if you said, well, I'm ready to get pregnant now, they'd say you have to come off the pill 6 months to a year in advance to start the whole process back again. So they've gone from 100 micrograms per pill down to 20. Less estrogen, less heart attacks, less strokes, less clotting problems, but more pregnancies when you forget your pill. So just a word to the wise. Okay, then. And there's always a sperm within a 300-mile radius. It might not be the one you, honestly, it's not the one you want, but there it is. So, okay then. So, anybody have any questions about St. John's wort? Just suffice it to say, make sure you ask about it. I always mention a little story, telling you I'm a nurse practitioner of peds, and we had 2 kids coming in to our clinic. Little boys, 7 and 9, and they both came in with gynecomastia. Big breasts, you all. I mean C cups. These kids were like, well, oh my God. I mean, not to their face, but as soon as they walked out, I was like, oh my God, it just those breaths. So, and they're 7 and 9 years old. So what do you immediately think about? Oh, do they have tumors? But they were brothers coming at the same time. So that just didn't make sense. But we asked the parents, are they on any drugs? No. Are you sure they're not taking anything? No, we give them a Flintstone multivitamin or something, which is not a big deal. So went on and on, asking questions, exposure to this, exposure to that, exposure to this. No, nothing. We just could not figure it out, so we had to work them up for testicular tumors, adrenal tumors, pituitary tumors, all that whole axis of tumor things. Couldn't find anything. So when last day we walked in, and they came in with Grandma. Grandma had come from Guatemala about 3 or 4 months ago. And Grandma was sitting in the room, and one of the other people sitting in there said to her, are you sure you don't give your little grandkids anything? She said, oh, I give them something. I brought it from Guatemala, and, you know, they're just so active that I thought they needed to be calmed down. These are 2 little boys, y'all. They're 7 and 9. They're brothers. What do they do all day? Fight, play. Of course they're active. They're not hyperactive. They're boys at 7 and 9. But she gave them a concoction from Guatemala that contained lavender. And lavender is a potent estrogenic compound. That's what was causing their massive gynecomastia. Now, it's not going to help you get a C cup if you're writing it down. Darn it, lavender, C cup. Sorry, it doesn't work in women. It just makes boys' breasts big. As soon as we took the concoction out of Grandma's hand from Guatemala, their breasts went down to normal size. So ask about, I always tell my nurse practitioner students, ask about Grandma from Guatemala, because there's always maybe something else that's, you know, Grandma from China, Grandma from India, bringing things that you don't know about. So, okay, so we got the vitamins and the herbal supplements. I'm going to talk about a little bit about vitamins, y'all. There's nothing wrong with taking a multivitamin. Nothing wrong with it. However, it will not save your life. It will not reduce your risk of dementia. It will not reduce your risk of heart disease. It will not prevent a cold. It will not do anything in terms of clinical medicine. What it does is it gives you any nutrient that you just don't get in your daily diet. It will fill that space if you don't get boron or magnesium or something like that. It's just not a cure-all or be-all or end-all for anything. Now, I take a multivitamin because even though I eat well, Why not? There might be a few things that I just don't get in my diet. Selenium, for example. Who knows? But the point being, it's just not a miracle cure for anything. Okay. Will it hurt you? No. Will it help you? Probably not. Now, that being said, we have people out there that will take way too many vitamins because they've read in Prevention magazine that this vitamin is good and that vitamin is good, and prevention's usually pretty good. But sometimes people say, well, you know, if 2,000 is good for me, I might as well go ahead and take 10,000. And that becomes a problem. And vitamin A is one of our biggest concerns. Vitamin A is absolutely, totally, 100% liver toxic. It will kill your liver if you take too much. So in the years I've been in nursing, we've gone from 5,000 a day as what is referred to as the normal dose, recommended daily allowance, daily equivalent, daily quotient, whatever you want to call it these days. Now we're down to 2,300. It's an IU, international unit. So right around 23 for women, right around 25 for men. No more than that, you all. You don't need any more. It's good for your eyes. It's good for your immune system. It's good for lots of things. But you don't need to overdose. In fact, does anybody here eat liver? How often? Yeah. There's nobody in here that has liver-seeking behavior, meaning that you can't wait to get out of here and have 5 pounds of liver tonight. Yeah, I don't know anybody that's addicted to liver. Liver, calf's liver, has 14,000 international units in a 3-ounce, which is nothing wrong with that because you're only eating it twice a year. If you ate liver every day, you would overdose on vitamin A. But I don't know of anybody that eats liver every day. Chicken liver is about 12,000. So you know that when you eat a liver, you will get plenty of vitamin A. You honestly don't need to take any more if you eat liver even once a month, really. But anyway, my point, and you eat carrots and those kinds of things with vitamin A. Just don't overdose, you all. Liver failure is a result of too much vitamin A. And now we're back to being on a transplant list. Okay, so vitamin B6. Oh, by the way, polar bear liver. This is an interesting piece of information. It's a piece of trivia that probably nobody will ever use, except at a bar one night when you've had too much to drink. Polar bear liver, 3 ounces, has 1.5 million international units of vitamin A. If you eat 1 helping of polar bear liver, you will die. And that's kind of interesting because that's what the Inuits fed to the explorers as they came across Antarctica, the Arctic. You hungry? We got some polar bear liver here for you. A lot of them died from it, you all. They ate the polar bear liver. They were starving, ate the liver, and boom. Okay, then. So if anybody ever offers you some, you know that they really don't like you. All right. Peripheral neuropathy, B6. Let's talk about vitamin B6. We all know it as pyridoxine. And maybe you don't remember all your vitamins, but this one's an important one too because it's paradoxical. Pyridoxine is paradoxical. Too much B6 causes peripheral neuropathy. Too little B6 causes peripheral neuropathy. Now that's one of the most annoying things I've ever heard. But it does say to you that B6 is important for maintaining peripheral nerves and also your brain. So myelination. So when we have a patient that walks in the door with neuropathy, besides the top 3, what are the top 3 causes of neuropathy? If you had a person sitting in front of you who had neuropathy, what would be your first thought? Diabetes, absolutely. Slap you if you didn't think about that first. But the next 2 are B12 deficiency and thiamine deficiency, which is B1. B vitamins equal brain. They help your brain and nervous tissue, whether it's peripheral or central. B vitamins, very important. But there's also a whole list of other causes of neuropathy, you all. Certain drugs cause peripheral neuropathy. Can you think of any? INH, if you're ever using that for TB these days, which we still use. We also know some cancer drugs called vincristine and vinblastine cause neuropathy. So there's lots of things out there where there's a list, but your top 3 by far take care of most neuropathies. Anyway, a B6 deficiency and a B6 excess can cause. Yes? Yeah, it's like 2. That's low. You take 2 milligrams of B6 on a daily basis. Now, when we use it to prevent neuropathy with INH, we give you 50 milligrams a day. It's not too much because you're preventing it. But some people take 2,000. I don't know why. They're idiots. So you don't need that much.
Is it 2 for somebody who's healthy? Or is
Yes, for a healthy dose is 2.
No, I mean, is that for someone who needs it in their diet, or is it somebody who has a disease?
Oh, if you have a deficiency, we're going to pump it up for you. We're going to give you 50 to 100, most likely. So,
Mine's good enough for personal reasons.
okay. Do you know if you have a deficiency?
I've never been tested.
You have a neuropathy, though. Okay, and they've tested you for diabetes and B12 deficiency and B1. And you're a mess?
I have MS.
Oh, you have MS.
Yes,
You're a mess, too. That's MS. Well, your neuropathy is probably due to MS, but let me tell you something about your neuropathy with MS. If I were you, I would take 1,000, at least 1,000 micrograms of B12 a day. Are you on B12?
Yes.
Okay, how much are you taking?
Actually, I
Okay.
just buy it over the
Okay.
It's like
1,000,
1,000.
yeah, because that helps to keep your nerves healthy. Your MS probably is causing a little bit of damage with your central nervous system, not peripheral. But the central demyelination can cause the same kind of pain. Yeah. So you have a central neuropathy, not a peripheral. But you would probably still do well with a B complex as well. Mm-hmm. Okay. And I'll think of more things for you, too. Are you taking 6,000 of vitamin D a day?
Not 6,000.
Okay. How much?
I do take vitamin. I take B3,
That's fine.
and I'm not sure how much.
Okay. Well, we're really looking at 4,000 to 6,000 for MS patients. So that'll also help. So, good. At least you're on the right stuff. Mm-hmm. All righty then. So, B6, you all. Neuropathy. Okay. Vitamin C does not work to prevent colds. People call me all the time, Barb, I had cold. Should I take 2,000 of vitamin C? No. You take 2,000, your kidney excretes 1,500, so you've just wasted. Your kidney can only handle 500 at a time. So if you're going to take it, then 500 is all you should take, or the toilet will be healthy and you won't. But it doesn't prevent a cold, you all. Does it boost the immune system? Yes, but there's no cold prevention here. What actually does boost the immune system, and I'll come back to vitamin C in a minute, is something called zinc. Zinc does give the immune system a little bit of a boost, but if you have MS, you don't want to take it because that would cause you to have more of a flare-up. Same thing with echinacea. You do not take echinacea. You're getting a cold, you say, oh, but got to be at the cold. If you have MS, it will cause a flare-up. It's too much of an immune booster, and that's what you don't want. So, point is, if you're taking vitamin C to prevent a cold, stop it. Now, one of the most important uses of vitamin C actually is to help you to absorb drugs that need an acid environment. What's the name of vitamin C? Ascorbic acid. So, a lot of times, how many people in Springfield, Illinois are on drugs called proton pump inhibitors? GERD drugs. Everybody. Why not? But you have no acid in your stomach. So now you give them a drug that absolutely requires acid for absorption. If there's no acid in their stomach, how well will that drug work? It won't. It won't be absorbed like it's supposed to be absorbed. And so you need a drug you need something that's going to help you do what? Absorb that drug through a no acid environment. Taking a vitamin C pill with it will do that. I don't want to take another pill. Is there any other option? Yeah. 2 ounces of Coca-Cola Classic or Pepsi Cola. Each of those has a pH of 2.3. It's like, or you could drink battery acid. You have 3 choices: Pepsi, Coke, and I'm not talking about Diet Coke. Diet Coke actually has a pH of around 4. You really want a pH that's around 2, and that would be the acidic pH that your stomach normally is. So Coca-Cola or Pepsi Cola or vitamin C. All righty. Of course, we know about D. Well, maybe you don't know about D. Vitamin D is the vitamin du jour. It's the vitamin of the day. If you need any money for any research purposes whatsoever, just mention vitamin D. I don't care if you're researching fungal infections and earthworms. Just mention vitamin D because you'll get money for it. It's just a huge, huge research vitamin today. Years and years and years we thought it was only good for your bones, but now we're realizing vitamin D has receptors on every single cell in your body, which means the only other hormone that has receptors on every other cell of your body is thyroid hormone. So vitamin D is a metabolic hormone, you all. It's a hormone. It's not a vitamin. It was misnamed years ago, and nobody dares change the name to hormone D. It would just mess up everything. How could you say vitamin A, B, C, E? You'd have to skip the D. So it's actually a prohormone. So my point being is that most likely we are going to find many clinical uses of vitamin D, none of which yet have been proven with evidence-based medicine except for its use in bones. We do know, however, that vitamin D helps to prevent falls in the elderly. We do know that vitamin D is very much beneficial for depression. We have lots and lots of clinical uses. We certainly know in MS patients and Crohn's disease, vitamin D plays a very important role in reducing symptoms. So there's lots and lots of new stuff coming out. But if you really are basing all of your clinical practice on evidence-based medicine, then you're going to have to wait a while to get all that down pat. But a lot of people are using vitamin D for these things. And lots of it, you all. You say, well, how much is too much? You know, the last study I read was if you took more than 10,000 international units a day for greater than 3 months, you could get some vitamin D toxicity. We never recommend that much, you all. And people say, well, my doctor gave me 50,000 international units, Barb, to take because he said I was vitamin D deficient. But he gave it to you to take once a week, not once a day. So it's 50,000. It sounds like a horrible amount. Oh, my God, that's too much. Not really when you spread it out over 7 days. So is D3 the best? Not necessarily, but it's the active form. D2 is inactive and has to be converted in your body to D3. So why bother taking something that needs to have a second step? Because I have 3 bottles of it in my medicine cabinet that are D2. Then go ahead and finish it up. The next time you buy it, buy D3. Any questions on D? Well, you also know it's the sunshine vitamin. Now, why do you think we get sick in the winter? One of the big reasons is there's not enough sunlight. Not the only reason. We're also indoors and everybody's sneezing, snots and hex coughs and everybody, but it's still, there's the lack of vitamin D in the winter that helps to, unfortunately, contribute to that. Okay, then E. No extra benefit for hearts, you all. So vitamin E, of course. We used to be taking thousands of it. I remember the day where people were taking 3,200 international units of vitamin E to protect their heart. No. What's in a multivitamin is fine. 200 to 400 a day is fine. Nothing more, nothing less. We actually saw that the people who were taking that, the older they were, the more they would get heart failure with too much vitamin E. So that was not a good one. And then the other thing we're looking at, of course, is vitamin E and its effect in the liver. We have an epidemic today of fatty liver disease called non-alcoholic fatty liver disease. In the old days, the only reason your liver got fat was because you drank too much Jim, Jack, George, Bud, or Jose. Today it is the diabetes and the obesity epidemic that we're seeing causing fatty livers. Those high triglycerides associated with obesity and diabetes are being smacked right back into that liver, causing big fatty livers. So, number 1, lose weight. Number 2, control your diabetes. And number 3, take vitamin E. 800 international units a day does help to reduce the fat in your liver. Why don't you want fat in your liver? What does it do? It triggers an immune response. The immune system says, oh my God, you have fat in your liver. Let me attack it. So they attack the liver and the fat, causing inflammation. And that's called non-alcoholic steatohepatitis. So now you've got an inflamed liver. And once you inflame something, you then start forming scar tissue. And that's called fibrosis, which leads to cirrhosis. So fatty livers, I don't care what causes them, you all, are a major cause of cirrhosis of the liver. That's why we're worried about it. The other major cause of cirrhosis of the liver are viruses, as you know, B and C. So we've got fatty liver disease and hepatitis B and hepatitis C as our major causes of cirrhosis of the liver, besides booze. We know that. So the hepatologists of the world are predicting that as our hepatitis C rates go down, which they are going down because we don't have it in the blood anymore and we don't have as much of it being passed to people, that the number one cause of cirrhosis of the liver in the future will be fatty liver due to diabetes and obesity. Okay, on that unhappy note. Well, it's important. Just something as simple as weight loss can reduce your risk of fatty liver. Simple. I say simple. What is that? It was simple when you were 18. Remember? You'd lose 5 pounds in 5 minutes when you were 18. Today it takes 5 years to lose 5 pounds, and in the same time you've gained 15 trying to lose 5. So it's just change. Things change. All right, last but not least, how about calcium supplements, iron supplements, soy supplements? What's the operative word here? Supplement, supplement, supplement. Supplements and multivitamins interfere with synthroid. So if you take your synthroid in the morning, for those of you who have hypothyroidism and you're taking levothyroxine in any way, shape, or form, you cannot take supplements, separate everything by 4 hours. 4 hours. So you take your levothyroxine before breakfast on an empty stomach. You will take your multivitamin at noon. You will take if you take supplements, you will take any supplements 4 hours later. It makes your levothyroxine less effective. You will not get the same benefits. So I'm going to digress for a moment. This brings me back to calcium supplements. What's the newest recommendation? Don't take them. The newest recommendation is get all your foods, all your calcium in foods. I can't, Barb, I'm lactose intolerant. No, you're not. Well, take Lactaid if you feel like you're lactose intolerant. You can drink a little bit of milk even if you're lactose intolerant, you all. I don't mean an 8-ounce glass, but you can slowly increase the amount you drink and not have problems. You say, well, I don't like milk. Fine. I have problems with yogurt. Fine. Cheese. Fine. There are how many foods out there that contain calcium that have nothing to do with milk, yogurt, and cheese? Spinach. Nuts, almonds have calcium. Black-eyed peas. I mean, the list is a mile long. There are thousands of foods with calcium in them. So the reason is this. Now, you say, well, Barb, my doctor said I could take 800 in pills and the rest of it should be in foods. That's fine, but most cardiologists today are saying no calcium supplements because the calcium from supplements, we now realize, shame on us for not knowing this, but when you never know once you start looking long term, is deposited in your coronary arteries. This is called a coronary calcium score. The more calcium in your arteries, the harder they get. The harder they get, the more fat is deposited in them. It actually contributes to heart disease. It's rude. It's annoying for all of us who've been taking calcium all these years as supplements. But we really recommend you don't do it anymore. So get out there, go on Google calcium-containing foods. You'll get a list from here to the end of the room that things you can eat and get 1,200 a day without a problem. I get all mine in ice cream. Okay, so speaking of levothyroxine, you all, nighttime dosing may be more efficacious than daytime dosing because of better absorption, but that doesn't mean you need to change it. There's just a study that came out showing that some people get a little bigger bump with their levothyroxine if they take it at night. If, however, you take it in the daytime, that's not a big deal. If you're used to doing it, then stay with it. As long as you take it at the same time every day on an empty stomach, period. Okay, most important then, same time, same day, empty stomach. Adjust doses as the patient ages. You know, we have some people that come in, they haven't had a dose change. They've had this disease since they were 50, and they're now 80, and the dose hasn't changed. Here's the problem. Most people, as they get older, need less. You need to go down with the dose. So, well, okay. What would it cause if the dose was still the same when I'm an 80-year-old versus a 50-year-old? It's one of the #1 causes of atrial fibrillation in the elderly is levothyroxine. You're now older. This dose you took at 50 is now causing your heart to beat too fast when you're 80. So what's one of the first questions you ask any 75-year-old with atrial fibrillation? Are you on what? Synthroid or any thyroid supplement? Well, yes. Been on it since I was 40. Did your doctor change it? No, been on the same dose. So you don't have to cardiovert them. You don't have to do anything fancy. You just have to do what with their dose of levothyroxine? Reduce it. So, levothyroxine doses decrease. Now, some patients only need 0.5 micrograms per kilogram a day. When you're younger, when you're first diagnosed, you need 1.7. You need a much higher dose when you're 42 years old with hypothyroidism. So be aware of that. You know, a lot of times, and no offense to doctors, I'm not making that. A lot of times, even as any healthcare practitioner, you just keep writing the same prescription. Just refill, refill, refill. And all of a sudden, it's 30 years later, and this refill isn't working the same. All righty.